Angie Hill. She works for Watertown Regional Medical Center. She's an occupational therapist. I'm really excited to have you here today. This is a huge group, so obviously this is a really popular subject. So if you need anything, I'll kind of pop in here and there, but otherwise you do your thing. Everybody want to give her a warm welcome. She came in
Thank you, Maria.
Yeah.
Okay, so like Maria said, I'm an occupational therapist. I have been in the OT field for 27 years next month. It's hard to even believe that, but it's true. And I have been working, I received my master's in 2016 from Concordia University, and after being in the field for 16 years, went back to school as an older student and graduated in 2016. I did my clinical rotations at Frederick Hospital in the spinal cord and neuro section of the hospital. Ended up cross-training into the general medicine, ICUs, then landed more permanently in oncology rehab and also orthotrauma, hence the shirt here. But at any rate, I ended up coming back to Watertown. This is where I'm from. And I work for Watertown Hospital in the outpatient department in the occupational therapy section. So if anybody has been to therapy at all before there, you know PTs, there's a lot of PTs, not so many OTs, but I'm super excited to have started studying a new area that I haven't studied in the past, and that's pelvic floor therapy. So the reason being that I am 51, I'm postmenopausal. I had a hysterectomy at the age of 40, went into the hysterectomy with already having urges, incontinence, bladder incontinence, and came out not a whole lot better. So then that threw me into menopause. I have my ovaries, and I did not receive any estrogen, nothing for menopause, perimenopause, and just kind of just suffered with the night sweats, you know, sweat pooling everywhere. And I decided that, well, I don't want to have other people in the same situation that I have been in for 10 years, still suffering with incontinence. So I decided that I could learn some things too and teach others. So occupational therapy is really a very holistic biopsychosocial model. We've been around since World War I. We focused a lot on activities of daily living and looking at how activities can be modified so that you still have good physical and mental health. So that's kind of where occupational therapy started. Pelvic floor therapy has been around. Primarily, I think many therapists are physical therapists by trade. And so occupational therapy is getting more involved, and that leads me to a level 1 certification that I am receiving tomorrow after completing 5 months of coursework and also manual therapy work as well. It took me to Detroit, Michigan, and also to Cleveland, Ohio. So I want to encourage everyone to listen to your body, and if you feel that something is resonating, of course, you can always ask questions. I do say this, I am not a pro or an expert. This is kind of just on your own. But I'm available for questions. I can always help you and guide you towards something that would help you. But I do have a slideshow ready for you, and also I'm going to start passing around some sheets. So some of you already have some sheets, so you might need to share, and these will be available via the PowerPoint, I think, like Maria said, it'll be available on some sort of website. I'm sorry, I don't know which one, but so everyone has a pelvic floor. Everyone in this room has a pelvic floor, just so you know. This is not just women. We all have a pelvic floor. So you do too. And here's the shocking part, right? Is everyone can have bowel and bladder incontinence. So that's the shocking news. And maybe it's not shocking to everyone, but that as our body changes, so do our muscles, right? Just like we're all here at the YMCA, we have memberships to, we probably don't come here just to visit with our friends, but they work out, gain some exercise, cardio, muscle mass. I have a couple extra there too. So I have a couple extras if somebody didn't get one particularly. Yep, there you go. Okay. I try to plan for 25 to 30 people. I got a little heads up about that. Okay. So anyway, I have more sheets, but we'll just kind of get started with a PowerPoint. And also, if you have any questions, please feel free to raise your hand, stand up, shout, wave, whatever you want to do. Can everybody hear me okay? Okay, all right, good. I've never worn one of these before, but as long as you can hear me. So the objectives of today is kind of identify how the pelvic floor works and the anatomy of the pelvis model that we all have, okay? And then also identify what happens when the pelvic floor has a dysfunction and identify what can be done to improve your pelvic health. And then who can I see for pelvic floor dysfunction? So the pelvis, I found this great picture because that's really what these muscles are, is the hammock between our sit bones, okay? So everyone find your sit bones. They're right underneath you, they're really hard. Sometimes they cause problems, right? They can cause pain. You're like, I've been sitting too long, I can feel this. So right in between this bone here and this one here are all these muscles here, kind of like a hammock. So if everyone can see, it's a sling sort of thing. So it's like a hammock. It holds everything in. And on this model here I'm holding, you can see the sit bones. We did that. So the pelvic floor consists of 14 muscles. So these muscles aren't just in between the sit bones, but they also go around the pelvis. So some of these come around, they give us troubles like maybe look like hip or feel like hip pain, that kind of thing, but sometimes it's the muscles or nerves or, yeah.
Show me which is the front and which is the back.
Okay, so this is the front. So your pubic bone is right in the front here, and you can probably all feel that. And then right up from there is where your bladder sits, okay? So, let me get, I don't want to break the pelvis. Oh, okay, the pelvis is breaking. Oh boy, oh, that's scary. Okay, so anyway, this, if I can hold it correctly, this is your bladder right there. It sits right on top of the pubic bone. So if everyone can kind of feel your pubic bone ends here and it's right up from there. So you can feel it, okay? Has everyone heard of something called double voiding? No? Okay. So the bladder sits on top of that pubic bone, right? So, and everyone has one of those, okay? So what happens when you might hear a term called double voiding, it's actually where you lean forward and as if you're tipping that bladder forward. So you're trying to empty it like you would empty a pitcher of water. Okay? So you lean forward, you might get some more dribbling, right? Now guys and men and women can do this, they lean forward. Then the double void is actually when you kind of squat above the toilet, but you're not on the toilet. So you squat above the toilet, then you sit back down in the toilet, tip forward, and try to empty it again. So sometimes that can get out maybe a few more what we call cc's of liquid. That's double voiding. So I encourage you all, if you are feeling like you're not quite finished, or you dribble a little bit after going to the bathroom, to try the double void. Because that bladder just sits there on the top and might have a little bit more liquid in it. Okay? So the pelvic floor is a group of muscles that support the bladder, the uterus, and prostate, and the rectum. It plays a significant role in the following: bowel and bladder control, sexual function, core strength, posture, and stability. So it's got a big job. And so when muscles get weak, they are not able to do their job well, okay? All right, the pelvic floor forms the hammock from the pubic bone to the tailbone. So pubic bone here, tailbone back here. Okay, so this sits right here. I don't know if you can all see me. I'll just kind of walk around with my pelvis. Get my pelvis out. So this will be the back side, okay? So a lot of people are like, my tailbone hurts so bad, I fell on it. Well, it probably does hurt because everything is right there. That's where your tailbone is. And guess what's there? The rectum, okay? So those muscles, the rectum, the vaginal opening, and the urethra all pass through the pelvic floor muscles. So it'd be no wonder why that would really hurt if you fell on it, okay? So, let's see, where are we included as the layers? Okay, so the layers, there's 3 layers of pelvic floor muscles, okay? And all of those have names, and they're very long names. So it interacts with your diaphragm. Everyone, your diaphragm, it sits right underneath your ribs, your diaphragm, your abdominal muscles, and your back. Okay, so the layers of the muscles all interact with the diaphragm, the abdominals, and the back muscles, and it's called your core. We've all heard of the core, right? Mm-hmm. Yes. So that is, it's all part of the system. The pelvic floor system interacts with these parts here, and those parts will contract or relax for things like breathing, digestion, bowel movements. They're all just so important, right? We have so many functions in this vehicle that we drive here. All right, let me just check to see where we're at. Okay, so this is a good picture of the core that we just talked about. The spine muscles, the multifidus is back here on your back side, running alongside your spine, and kind of interjects or interacts. The abdominal muscles we talked about, the transverse abdominis is lower here, so everyone has this as well. So if you were to try to sit up, I'm sure everyone could kind of contract that right now if you just practice this transverse abdominis. So try to just contract your lower abdomen. Everyone kind of trying it, you can do it. Good. All right. And then your pelvic floor muscles are down there. So you can see how that all intertwines together. Is that a good picture? Mm-hmm. Okay. And please tell, am I going fast? Is it okay? Okay.
No, you're good.
Slow down a little bit. All right, so the job of the pelvic floor muscle is to support. So talking about supporting the core muscles we just talked about. Supporting the pelvic contents. And then contribute to hip and pelvic stability. And then it's also sphincteric, which is bowel and bladder control. And we talked about those are sphincters, okay? The vaginal opening, the urethra, and the rectum, okay, all have muscles around. Okay. And then also the sexual part provides tone in the vaginal walls, maintains erection and orgasm as well. Okay. So how many of you don't have to show hands, but I already told you, so have had pelvic floor dysfunction. That includes dribbling urine when coughing or sneezing, not making it to the bathroom in time, low back pain, feelings of something heavy or something coming out of your vaginal canal, not a baby, or your rectum as well. So there are people that have prolapse. That's what that's called, is a rectum prolapse, a uterine prolapse, and also the bladder starts to prolapse. So everything can start caving in here. So it's supposed to sit nicely, right? Sit nicely where it's supposed to stay there. But what happens is that the muscles get weak. And we know what happens with muscles that get weak. What happens? You don't use it and you will lose it. Right. So that plays a factor in this as well, in your body, in your pelvis. All of these things can start to cave in as we get older. We know that muscle gets weaker. I don't know how many of you have heard recently about, they say as we get older we need to use more weights. More weights, yep, to strengthen muscle. And talking about the core, that's what we're talking about, is try to keep everything in its place. Okay, and let's see. The other piece is we don't have to pretend that nobody has sex here, because we all have, and we all will, and we do. How many people have experienced painful sex or tightness? How about constipation? Not able to completely have a bowel movement, feeling like you haven't emptied all the way. Maybe you feel like you have to go back to the bathroom again. What do we do when this happens? Maybe it's normal. This is what I thought. Maybe it's normal. I had a big baby. She's 8 pounds, 10 ounces. I had her a long time ago. Maybe this is just how it's supposed to be for the rest of my life. I don't know. If you don't know what you don't know, right? Unless somebody teaches you. Oh, I'm in this body, but I didn't really know all this stuff before. So. Or maybe it's menopause, or it's my hormones, or maybe I had cancer and I had treatments, and so yeah, all this stuff is just, I guess that's just part of my age. However, it's not just a female issue. We know it happens to men too. They don't deliver babies, but they have a pelvic floor, and muscles can get weak or tight and cause pain in the rectum, in the back, pelvis, or penis. The different types of incontinence, you all have that. So we can look at that sheet. Okay. Everybody have one? No. Okay. I don't think I have any more.
I have a picture of it.
But, what's that? Okay, sorry. Okay, so different types of incontinence. There is something called stress incontinence, unexpected leaking when coughing, sneezing, exercising, lifting objects, or laughing. There's urge incontinence, a sudden need to urinate that is so strong it cannot be stopped, also known as overactive bladder. There's something called mixed incontinence, a combination of stress and urge incontinence. There's overflow, the bladder overfills, forcing urine to leak out, even if the individual feels as though they cannot completely empty their bladder. There's reflex, bladder muscle contractions cause urine to leak out without any warning or urge to go. And functional, when an individual cannot get to the bathroom fast enough or cannot recognize the need to go to the bathroom due to impairment. So that's a lot, right? A lot of different kinds of incontinence. This is just mostly, and like I said, individuals may experience urinary or fecal, loss of stool incontinence, or a mixture of both. So you can kind of see on that right side here that this is kind of the comparison where stress might be a little bit, urge might be a little bit more, mixed several more cups. So it just sort of depends on your body. And so that's the different types of incontinence. Any questions so far? So we talked about emptying the bladder entirely, right, by doing something called the double void, where you can lean forward, empty that bladder a little bit more, and then kind of squat over the toilet, and then sit back down and empty again, okay? So now I'm gonna pass out another sheet here. Maybe you all can share. This one maybe wouldn't be quite as imperative to have your own. Okay, has anybody heard of the squatty potty? Okay. Not for kids. Adults can use them too. So this sheet that I'm passing out has to do with why a squatty potty is helpful. Because we didn't have squatty potties when we were growing up. We had tiny little toilets, or we just had regular toilets, maybe a step stool. So really, the squatty potty is best practice really to empty your bowel. So this kind of shows a picture of sitting versus squatting, and it's not a super good picture, I apologize, but the squatting does open the sphincter up better than just sitting. Some people have higher toilets, and then they're not really touching the floor anymore. So you can kind of see, the squatty potties have become so popular now. There's all kinds of them on Amazon. And I encourage you all to take a look at those and see, especially if you feel like you haven't quite emptied all the way, or you have some that might try to sneak out some fecal matter. So it would be advantageous to look at Amazon and look up squatty potty and see all the results for squatty potties. So, does anybody use one? Okay, I use one. I'll say first. I use one. I do find it's very helpful. I've had chronic constipation for many years, along with weak pelvic floor and things that I didn't know about. But I did purchase the squatty potty, and it's been quite helpful with trying to empty or evacuate the bowel movements. So that's helpful. Okay, so let's see here. I just want to take a look at where we are and where we're going. Okay, so now we're going to get into a little bit of I'm gonna back up 1 minute here. Okay, as long as we're talking about squatty potties and emptying the bladder all the way. So this is something that I would give a patient of mine very early on in the evaluation process, if not the first or second session for sure, because, and I'll tell you, the compliance with it is not the greatest, but I guess the idea is you have, does anybody want one? I'm gonna look at it, or like I said, I think I might have enough, but if you wouldn't mind passing these around, just kind of pass the packet on from. So I'm gonna move around a little bit, but the bladder diary basically is something for you to take a look at yourself. What is happening? What am I eating? What's causing this? You know, and I can think back like, okay, I had some Mexican food, or maybe I had Italian food, or maybe I didn't drink enough water, or maybe I didn't exercise that day, or maybe I ate gluten. I mean, you know, the list is long, right? We all go through that. I know I'm not the only one. So I know that other people suffer with this too. It's just that having a diary of some sort really does help you divvy it up to be, what kind of symptom did I have? Did I leak it all? Did I make it in time? What kind of accident did I have? Or was I exercising at the time and I was doing some sort of heavy exercise with a weight, or squatting or jogging or whatever the activity was. But it basically gives you some sort of an idea of what happened. And then you can take this to your provider, okay? So in order to come see a therapist that specializes in pelvic floor therapy, we need to have an order from your doctor that says OT or PT for pelvic floor strengthening due to urge incontinence, bowel incontinence, prolapse, which we talked about. The prolapse is when the organs start to kind of cave in and feel heavy down there in the pelvic region. So in order for me to help you, I need to have an order. So, and the order would come through to our physical therapy, occupational therapy unit, and then I would be able to treat you. Right now, I'm a one-man band. We're hoping to get more therapists on board, but that's, you know, normally, let's say I might only see people twice a month anyway. That's sort of the plan of care for a lot of patients. So I give people diaries to write down what they're eating, the symptoms they're having, so that they can come back to me and it helps me problem solve with you if you were a patient of mine. So I appreciate things like this. Otherwise, I'm kind of guessing, but you know, I'm getting better after 26 years listening to patients, not necessarily just talking about their pelvis, but just listening, right? Just listening to what's going on, in what environment, where. Those are the things that OTs specialize a little bit more than just giving you, here's an exercise. No offense to PTs. I love my PT partners and friends. But we do look at a little bit more. That's our scope of practice. That's our overall model of care. So, all right, so that's the diary. Any questions on the diary?
What a good idea.
Good. Yeah, great. So I do want to say that I want to give the props to the NAFC, is the National Association for Continence. Okay, it's nafc.org. It has been a super awesome website for me to look at as a professional, but also look at for patients, to look at it from both lenses, as if I'm a patient, because I also told you I have these same similar issues. And also as a provider, what's out there for my patients, what's out there for patients like me. So I do feel like it's a super comprehensive website. It gives you exercises at a beginning, moderate, and difficulty levels, and also gives you a whole lot of information. Podcasts Without Leaks is the podcast that you can find, and I've listened to that a couple of times for sure.
What did you just say? What was it called?
This is called NAFC.
No, the one.
Oh, the podcast is called, I think, Without Leaks, Life Without Leaks. Let me just double check. But wow, what a wonderful resource at our fingertips. I just want to double check before I tell you that. Has anybody ever looked up any podcasts related to? No. I thought that was really, really great. Yep, Life Without Leaks. It's the NAFC podcast.
And what is the NAFC?
The NAFC is a National Association for Continence. So that's at the national level. They had a doctor on there yesterday talking about something called, well, maybe you've all heard Botox before, right? But also, so there are doctors out there that will actually do Botox on your bladder, Botox in some of the pelvic muscles, and also there's another procedure that he was talking about. It escapes me right this second, but that's menopause, right? Or postmenopause. It escapes me. I can't think of the word. But anyway, it's a really great podcast because you can really educate yourself, take notes. It's about 20 minutes, pretty easy to listen to. So, all right, so that's a great resource. Now moving on. Oh, sorry, no, we're not moving on. Okay, what happens when my pelvic floor is causing problems? So have you all heard of Kegels? Kegels, interchangeable. Okay, so that means squeezing in between your pelvic bones, your sit bones. You're squeezing that. It does not mean squeezing your glutes. It does not mean any movement. It doesn't mean this. Okay, so you're working on just the muscles between the sit bones. You want to practice it like you're practicing stopping the flow of urine or gas. Not while you're peeing. That's actually not good for your bladder or for your urethra and your urinary tract. So just do it when you're sitting here. You can literally just practice like you're stopping the urine flow. Okay? Okay, is everyone trying it? We're supposed to try it. That's what I wrote. Okay, do you want to stand up? Anybody feel like you want to stand up and try it standing? It's not just a sitting down thing, it's a standing up thing too. So you're literally trying to hold everything from here and pull it up. Squeeze and pull up. And then, so if you can stand up, you can hold onto your table or chair and contract those muscles, stopping the flow of urine, and then do the small squat. So let's try that. I do have that as an exercise. So let's just do it because we're about halfway. Anyway, that'll be good. Okay. So everyone should get it. All right. So I'm just gonna come around here too. So everyone hold on to the table or a chair, and you're literally gonna do a little squat. Oh wait, back up. Hold your Kegel, contract the muscles between the pelvis, and then squat. Don't hold your breath. Keep holding, keep holding, keep holding as you're coming back up again. So that's a good Kegel that will help strengthen your pelvic floor muscles. So let's try it again. Hang on, squeeze first, hold everything in, not your butt cheeks, just the muscles in between. Squat down, Keep holding, keep holding, keep holding, and come back up. And relax, everyone breathe. See, we all hold our breath. So now let's practice it without holding your breath. We're gonna count. I do the same thing. Okay, so everyone squeeze in between your sit bones. You're gonna squat. We're gonna count 1, 2, out loud everyone. 2, 3, 4, 5, and breathe. Okay, practice one more time. Everyone squeeze in between the pelvic bones. Count 1, 2, 3, 4, 5, and relax. Breathe. Okay, so that's a really great exercise to do. So I'm gonna pass out.
You're supposed to do that when you came to a stop sign.
Yeah, that would be awesome. Yeah. Yeah, yes. So I was gonna say, the example that we use is like, so like Linda said, I always thought I'm just gonna squeeze it while I'm sitting, real quick, squeeze, and a lot of times my butt cheeks to squeeze too. I thought that was good. I'm still leaking urine though, so it was not helping. So instead, it would be like this. If I was just constantly doing this with my muscle, okay, great. You got a strong bicep muscle, except for when you go to use it, it's stuck here, and it's not gonna really go through the full range of motion. So we need to work on those Kegel exercises during movement, okay? That's the key thing. I think that was a huge takeaway for me. I thought I did it. I thought I could do it, but it wasn't through movement. So now the thing about Kegels is that also, so let's say you have a lot of tightness in your, let's say rectum or in your perineum area. Now, I wouldn't necessarily always want to just do strengthening, because if I have pain, strengthening isn't going to be just the best thing. Sometimes people are not relaxing enough in their pelvic floor area. Okay, so if muscles are too tight, they might not be getting out all the urine or getting out all the fecal material because their pelvic floor muscles are too tight. So what do we do then? We don't want to keep strengthening something that's already too tight. Then there's going to be a real problem. You have more pain. So relaxation, deep breathing, something called diaphragmatic breathing. Have you heard of that?
Yes.
Anybody? Okay, good. That's super
We
great.
do it all the time in Qigong class.
Yes, great. Which is why we take classes like that. We take classes for strengthening, we take classes for relaxing, because that's what our body needs. We don't always need to be up here. We need to come down here too, so that all of these muscles can go through their full range of motion. So the relaxation, the deep breathing, diaphragmatic breathing. I do have another handout, but I don't know again if I have enough. So again, just to reiterate, I'll have access to these sheets for you on the website or something. Maria will make sure. But let's practice a little bit of diaphragmatic breathing. Okay, this is mine, I guess. Okay. Hold on, sorry. Well, you got the diaphragmatic. Okay, good. Oh, I was just gonna say, I think I got you. I think I gave you mine. Okay, well, let's practice the diaphragmatic breathing. You don't have to lay down. We can just do it here. So place one hand on your breastbone and one hand on your abdomen, just above your belly button or navel, okay? Slowly take a deep breath in and focus on trying to get your hand on your stomach to rise while the hand on your breastbone remains the same, remains still, okay? So right now I want to try to get a deep breath in my belly. Belly comes out. I'm particularly very good at belly breathing, but it's not really what I want to be good at, but at any rate, practice again, okay? So inhale, belly comes out. Exhale, belly comes in. When you breathe out, the hand on your stomach should lower. Repeat one time, complete one set once a day. That's not a lot. I think we need more than that. But the idea is to breathe into your belly. There's many of us that do a lot of belly breathing, or we do a lot of mouth breathing. So we're just kind of taking little short breaths throughout our lungs. The little lungs are just like little flitter flatters. They're not really opening all the way. Your belly isn't getting the breath. You're carrying a lot of tension in your low back. So all of this can really help expand and get breath in your entire body. Yeah.
We do diaphragmatic breathing probably about 20 to 25 times in each Qigong session.
Right.
In between each movement that we do, we will actually do diaphragmatic breathing, and we're just adding the tensing of the perineum muscles at the very top of the breath.
Okay.
And then it's very interesting. It's a good place to practice.
Okay, good. Yeah, that's wonderful to hear. It really is. Yeah, I feel like it's so important to contract it, but also to relax. Because like I said, again, if you already have pain there, it's gonna make it a lot worse if you keep strengthening something. So the reverse Kegel is actually reversing the pelvic floor muscles to let go of the urine or bowel movement, and you're pushing away from your body. So everyone just practice that too. So that's the relaxation part. Okay, so diaphragmatic breathing. You feel like everybody kind of knows about that and its importance? Okay. So what else can I do to help my pelvic floor? Do we have a sheet on irritants at all? Yes, bladder irritants. Okay, good. Yeah. So take a look at that as I get myself organized with my sheets here. Well, does anybody see anything on there that they eat a lot of? Oh my gosh, so was I. I was thinking, wow. Wonder I have some burning pains and GERD issues and all kinds of stuff.
What is ascorbic acid?
Okay, so I was gonna tell you, some of these I don't know exactly. However, they're in a lot of products. So check your ingredient list. Okay, bladder irritants or it's some sort of additive, I think. Black teas. Has anybody ever had any UTIs? Then they get there and they don't have an infection. Okay, but sometimes it can be this burning pain like a UTI, only you're not testing positive for any bacteria or anything like that. It can be something that is causing your bladder just to be irritated. So it's kind of like maybe lotion or a scent that you put on and you're itching. So irritants that you ingest can cause,
What about drinking, cranberry juice when you feel you have a UTI, but yet it's listed as one of the no-nos?
Yeah, so cranberry juice, I think I would definitely talk further with a pharmacist, but certainly cranberry extract is in a pill form. What I guess I wonder about cranberry juice is that sometimes it's not always in its truest form. There's an awful lot of sugar. in a lot of juices. If you look at, I'm just gonna give you my little side note really quick, my little sidebar, is that I look at all the juices, I look at everything that I eat and look at the sugar content, and let's say it's 34, let me just use 32 grams of sugar per serving. Divide that by 4. And that gives you how many teaspoons of sugar is in the product. That's a lot of sugar. On the average, I've seen juices that per serving has 6 teaspoons of sugar in one serving. Not to mention the coloring that they use for the artificialness. So if you were to take any type of cranberry, I would definitely do a cranberry extract pill. They have pill forms, they have capsules. So your bladder can be irritated by things like red 40 and blue blah blah and yellow. There are a lot of irritants in the artificial coloring of our food.
That's great advice.
So it's, again, I'm not a dietitian. I am an occupational therapist with a special needs daughter and 27 years of experience, yeah. Oh darn, reading glasses. Oh, I got a pair in every room and I still can't find them.
That's because they fall out.
Yeah. So, okay, so there's an awful lot of foods on here. But I think there's other lists on here too that you can use as a substitute. So I feel like this list is pretty good, actually. This is a pretty good list.
Angie, what about, in relation to this list, have you heard anything about the mushroom coffees? How that would fit in?
Yeah, so actually I have bought the mushroom coffees before and the low acid coffees before because I had that burning, I feel like I've had just about everything on these lists. But anyway, I had the burning of the bladder, and a lot of times it's from the acidicness of coffee, the acidity of tomatoes, you know. Oh gosh. I was wondering if it was gonna come out my pants. But at any rate, yeah, the acidity, I haven't heard anything necessarily about those types of mushrooms that they're putting in coffees now that are very good for energy and maybe your brain, things like that. I've actually tried them before. I thought it was pretty good. And the low acidic coffees are pretty good too. So I would try that if you ever feel like, am I getting a UTI or what is going on? It goes, it comes, it goes, so I would definitely try that. Yeah.
With each one of these foods that could be irritants,
Mhm.
does each one have like an amount you'd have to consume in a certain period of time?
Mm-mm. No. It can be a little, it can be very little. It can be that people just, they have to stay away from, let's say they have to stay away from pineapples. They get sores in their mouth, or they, it's too much acid, and it can be small, it can be a large amount. So I guess that's another plug for the bladder and bowel diary. Or even take these little notebooks that you can get at Walmart or Walgreens. Those little bitty ones, I love those. I wish everybody had one in their car. Just jot down, like, what are you feeling? Is that right or not? Or how did that correlate? I think a lot of good can come about from journaling your food and drink. Kind of like GERD, right? We are like, okay, I had that Mexican burrito. I love El Mariachis, but sometimes the food talks back, right? So I hope that kind of helps a little bit with the diary, the bladder irritants, talking about your provider for a pelvic floor therapy. What was I gonna say about, I have this sheet too that I still wanna give you. So this sheet here, let me just pass it out while I got a couple extra minutes, yeah. Let me find it here. So we did a couple exercises, right? We did the diaphragmatic breathing and we did the mini squat. This one here talks a lot about your pelvic health, your core functions. Kind of, we talked about this already a little bit earlier. So it just kind of reiterates again the function of the core. And I'll kind of pass this around again, just so that I'm not using up any time that you all might, if you have any questions or anything. Thank you. Okay. So everybody know how to get an order for pelvic floor therapy. This is not a plug for my business, by the way. I just work at the Watertown Hospital 1 day a week. It literally, sure, I would love to see you. If I could help you, I would love to help. But it literally is something that I've dealt with for so many years that I want to make sure that I share with others how to help your body feel better and advocating for yourself. I do want to tell you that, I do want to share with you that I wanted to show one thing that I do in treatment that helps people kind of figure out, because I sort of thought that I knew where my pelvic floor muscles were, even after I was been a therapist for a long time. So I kind of thought that I knew everything that I needed to know about that, and yet I didn't know. And so I want to show you that something that I use is something called, has anybody heard of biofeedback? Yeah. Okay, so biofeedback is a tool or modality that we use that kind of starts off with a little box like this, and it might be hooked up to a computer. It might be able to show you what you're doing with your muscle, or relaxation, or biofeedback's been around for a really long time as well. It's been really great to teach people how to relax. So this little box connects to these little electrodes. We put little pads, not in your pelvic floor, but on the outside of your rectum area, the muscles. So one on one butt cheek and on the other butt cheek, but not on your butt cheek, down by the pelvic floor. So we put those electrodes on. You're not getting zapped, you're not getting anything like that. But what we are able to see is if there's little lines that move across here or on a computer, I can see what your pelvic floor muscles are doing. So I ask my patients to contract, then I can see this wavelength go up, and then I can ask you to relax, and I can see the wave go down. So some people have a higher tone, a resting tone that's higher. Sometimes that means that you're having a hard time passing urine or passing a bowel movement because your resting tone is already high enough, too high. Remember what I said, you didn't really want to strengthen something that's already kind of strong? We got to learn to relax. It's called down training. I help you relax and learn how to down train your body to not be so, have this resting tone. And then sometimes I have to teach the pelvic floor muscles to contract higher, get a better strength behind it. So we use the biofeedback. Okay, so again, I don't want you to be afraid. I've actually tried it. I have a higher resting tone, shocker. But yeah, so a higher resting tone will cause me to have an inability to relax and causes constipation, can cause me to not evacuate the entire bowel movement. So that's kind of how that goes. Also, weak pelvic floor will not allow for your urine to come out all at once sometimes. So the more control you have, the better your body will work for you, okay? Okay, so I appreciate it. Okay, I'm just gonna say my thank you. I appreciate everyone giving their time to come and listen and interact with me regarding such an intimate topic. The presentation today was not designed to diagnose or treat, but was used as informative and educational. The resources were the National Association for Continence, and then that's my name. I have a master's in occupational therapy. I'm registered. I'm also a certified lymphedema therapist as well. So, and then just as of tomorrow, officially a level 1 functional pelvis certified. So, yeah, I thank all of you. So we can kind of open things up. We have just a few more minutes left. If anybody has a particular question that we want to talk about in general, or if you want to talk to me separately, yeah.
Would you put up the slide with the muscles involved?
Yeah.
I guess if I talk to somebody, I'm taking pictures now.
Mm-hmm. Yeah.
That one,
The core. Mm-hmm.
Thank you.
Yeah. Okay, I remember I wanted to read something to you that actually came from the National Association for, and that's this. Incontinence education and support for patients, caregivers, and professionals. Incontinence, the voluntary loss of urine or fecal matter, is not a condition that anyone should just have to live with. It's not something you need to accept as you get older or an inevitable consequence of childbirth or surgery. Incontinence is a treatable medical condition. Whether you have occasional light wetness, heavier bladder leakage, bedwetting, or bowel issues, no matter what type or degree of incontinence you might be experiencing, help is available. This is the place you should be. That's the National Association for Continence. That's their website there. So I encourage you all to, if you feel like you need support, to ask your providers. Yeah.
For you personally, do you have a daily or weekly regime of exercises or things that you have found to be extremely helpful?
So yes, as I've been learning, learning myself, I've been trying to apply the exercises as well, and my urinary, leakage incontinence has improved. And I do have a strong Kegel. I saw it on the biofeedback. So that's good. It's just that I have a higher resting tone, which is causing my pelvic floor to not allow me to evacuate all the way. Hence the constipation, and it's backing up. Yeah.
Could I invite everybody to my Qigong class?
Yeah. For sure, yeah. Yep.
My name's Greg David. I teach Qigong here at the Y, and I would like to invite everybody to the Qigong class. We do many of the things you're talking about, and we're incorporating tightening of the perineum muscles during our deep breathing exercises, and we do squats, and it's all very gentle, easy motion. As some of my class members I see in class talk about, it's not a hard art, it's more of a soft Chinese art. It's very ancient, and it's improved my health, and I hear a lot of testimony from my students that it really, really helps them too. So please come to Qigong. It's every Friday and Monday mornings. Monday mornings from 8 to 8:50 and 9 to 10, and then Friday mornings from 8 to 9 and 10:45 to 11:30.
Awesome.
Thank
you.
Have a good night.
Okay, really quickly, a good question came up. If I can just have everyone's attention. So, yes, we must talk about insurance, right? Because sure, there are some providers that do run a cash-based system. I actually, when I did my training for the functional pelvis, I actually worked with many colleagues that do a cash-based system because they want to bypass insurance. Insurance has us going through a lot of hoops to jump through. And sometimes what insurance wants to give us based on our documentation, or really, it's not even based on documentation. I think this is kind of funny. It's based on the diagnoses. They don't even look at my note and they give you 4 visits.
Oh, yeah.
So, I just want to let you know that's very common. So what happens is I working in Watertown here, I have to interact a lot with the insurance companies myself because I do the submission of the ICD-10 or 11 codes, and I have to write everything down. So yes, insurance companies, we work with insurance companies. The Medicare Advantage plans, we work with Medicare Advantage plans. I have not had any insurance deny coverage for pelvic floor therapy. Again, I would say that if you have the provider, your doctor would write you a script, because we are not a direct access. Well, I don't know exactly for PTs, but OT definitely isn't. So we need the order to say. If you know of somebody that you want to go to, just make sure you send the order to that provider for pelvic floor therapy due to urge incontinence or due to pain. So people still can, it's not just about incontinence, it's about pain. It's about pain, it's about tightness, it's about perineal pain, it's about painful sex, it's about all of it. It's all together. There's a huge list. I think I got 3 pages of diagnoses having to do with your pelvic floor. So burning of urine, there have been treatments that I have literally looked at where the urethra is. The urethra, now this is the other thing that some people hear is, oh my gosh, pelvic floor therapy is internal work. It can be internal work, meaning that I put on a gelled glove, I put on a glove, I put gel on my finger, and I literally insert that into either your vaginal area, and I do assessments of muscles, of the different layers that we talked about. Because sometimes I can't tell what's going on, but sometimes it's a urethra problem that's not mobile enough. It doesn't move. It needs to move, but it's not moving. So there's tightness there. I can give a little bit better objective data. However, that doesn't mean that's the only thing I do. I do the biofeedback with the stickers on the outside for teaching. It's called neuro re-education, that I actually teach you how to re-educate your muscles and yourself to do the appropriate squeeze and the appropriate relaxation. So yeah, and then there's also we're gonna talk about it. I sometimes don't do any of this at first. We just talk about it. We talk about bladder irritants. We talk about some exercises. So it's really tailored to, I give patients the options. Yeah.
Under bladder irritants,
Yeah.
like, I do a lot of these. What ones stick out like you should look at first? Are there any that are?
Yes, so I tend to look at caffeine is a huge irritant, I know. So that's why I was talking about that caffeine that has the low acid. I just saw some out on wherever grocery store I was at, but I was really happy about that. I was like, oh my gosh, I don't have to order this on Amazon. Just look up low acid coffee. Alcohol. It's unfortunate because I like it sometimes too, but alcohol is a big one. Yes?
What about decaf coffee?
Okay, so decaf coffee, yeah, I would say that's okay, but also there might still be some acidity in the caffeine or in the coffee bean itself. So again, I encourage you just to take a look at it and see. Yeah, alcohol, caffeine. I didn't know this, but some of the fruits and vegetables.
Is there a difference between lemons from the grocery store and lemons that you grow yourself?
I don't necessarily think that's the case.
Because they taste much different.
Yeah, I don't necessarily know that, but I wouldn't think so. Not positive. Also, maybe lemon juice that you buy in a little bitty thing. I'm not sure how much of that is even real. I don't know. So I guess does anybody have other questions? Yeah.
When you say we need to use more weights, are we talking about arms weights or what are we talking about?
Yeah, so back up to that menopause kind of, I think we can gain so much more muscle mass as we get older than what we think we can. So using small weights, using cans of soup, but again, doing it through movement. Like I'm doing side steps, and I'm doing some elbow crunches, or I'm squatting, taking side steps. Again, if you want to do a Kegel, I would encourage you, do a side step. Before you do the side step, you Kegel and then side step. You can squat, keep holding it, and then come back and then relax. So it's that exercise through movement. Yeah. All right, well, please feel free to leave comments or come and talk to me. If you have any feedback that I could, yeah.
Can you put the muscle slide back up, please?
Yep.
I was just gonna take a picture of it.
Sure.
Thank you.
Uh-huh. Thank you all very much. Aw, thank you.